Well, welcome, everybody. Thanks for coming out. I really appreciate you joining me. My name is Jeffrey Eagan. I'm a physical therapist, and I work for University of Colorado Health at our North Campus, which for those of you who aren't from the Front Range, that's Fort Collins, Colorado, about an hour north of here. I've been doing cancer rehab there for about the last 8.5 years, specifically working with exercise programs for cancer patients of all diagnostic groups. So please feel free to ask questions, especially if I'm being too general, too broad. You need to zero it in for your specific case or lung cancer in general. Just let me know. All right. They dolled up my slides for me. That's not how I made them. That looks great. So as the title indicates, exercise is what we're here to talk about. So I don't know what you guys think when you hear exercise. When I sit down with a patient and I say, yeah, your doctor sent you here to exercise, I get a number of different reactions. So I don't know, what do you guys think? Do you think, oh, that's a good thing, it's a bad thing, I hate to exercise? What do you think? Thumbs up, thumbs down, love it, hate it?
It's a good thing, but I don't want to do it.
Yeah, that's...
The motivation is missing.
Sure, okay. You don't have the energy for it, exactly. Yeah, so that, and I didn't actually pay him to say that, but that's a great segue into why are we even talking about exercise? I get that question a lot from my colleagues. What do you do? You're a physical therapist. What do you do for cancer patients? How are you going to help? Why are we even talking about exercise? What kind of problem are you going to be able to address? So, cancer-related fatigue. Who here has heard that term before? Okay. It's a real term. It's not just something we made up. The NCCN has a nice definition that I won't read to you because you're adults and you can read. But it's a very common problem, and that is actually my entry into cancer rehab. That's why they asked me to start the rehab program that I started in 2008, was to address this problem. Okay. One thing I do find really interesting that's on that slide there is that it is actually reported to be more distressing than pain, nausea, and vomiting. Does that surprise anybody? Okay. Yeah. Yeah, because people tell me I'm glad that my disease is being controlled, but I'm wiped out. I don't have energy to do anything. What are we going to do about that? So, how common do you think this is? This is like you said, interactive. Give me a percentage. How many patients being treated for cancer, all cancers, not just lung cancer, experience this? $80 to 90%, right? Pretty darn high. And again, and this is where exercise, I'm not going to sit here and tell you exercise is fixes everything. It's a piece to the puzzle, right? Fatigue is often correlated with other things, sleep disturbance, depression, pain. These things kind of work together, okay? And the management, we like this management of it to be multidisciplinary, right? It's important that you talk with your physicians because there can be some medical causes for why you're tired, right? So there's pharmacologic approaches, counseling, education, lots of different things. We want a lot of people speaking into this because it can be a big issue that negatively impacts your quality of life, right? Lots of statistics out there today about disease-free survival, length of survival, but what happens in that period of time, right? What kind of quality are we talking about? So that's what we're looking to impact through this multidisciplinary approach. So for myself, as a physical therapist, I don't prescribe drugs, so I am part of this non-pharmacologic team, right? And so what are one of my biggest tools? Well, guess what? You're here for the exercise talk, right? So that's what we're going to talk about. There's lots and lots of good research out there that regular, moderate intensity exercise is one of the most effective things for addressing cancer-related fatigue, okay? So what type of exercise is most effective? Cardio, resistance, what do you think? Which one's most effective? Sort of a trick question, it's both, right? There's studies out there, one is not better than the other or more or less necessary. And we're going to talk about what the specifics of those types of exercise, what that means, okay? how much, how often? Like you're saying, I know I should exercise, but I don't want to. How often do I have to do this? How hard does it need to be? The intensity level. We're going to talk about that as we get along in the talk here. I think that's probably one of the most common misconceptions about exercise that I run into, is people, they don't want to exercise because they think it has to be this painful, exhausting thing that you have to do 3 hours a day, every day, to get any kind of benefit from it. And I think that's one of the most common misconceptions that I run into when I'm talking to people about exercise. So let's talk about different modes of exercise. Cardio. So in order to kind of qualify as cardio fitness training, now again, making generalizations, you kind of break exercise into two broad categories, right? Cardio and resistance training. And some things don't fit neatly into those categories, but when we're talking about cardio, you want to exercise in a certain intensity range, and we're going to talk about what that means. You want to stay in that intensity range 20 to 30 minutes, up to 5 to 6 times a week. Now, you're looking at that probably going, there is no way I can do that, right? That's a goal, right? You're talking about, you look at different academic bodies, and they're going to make recommendations about what qualifies as cardio fitness training. This is a goal, right? This is not a starting point. You're going to hear me say that over and over in the talk today. Each person's different. You're all starting from a different place, and you have different goals, okay? So it doesn't mean you're going to try and go out and start doing that today. This is not where you start. That's your goal, okay? So types of things that in general qualify for cardio: biking, walking, swimming, rowing, anything that is kind of repetitive. You're getting your heart rate up, staying in that range, keeping it there for a certain period of time, okay? Resistance training. What in the world is a 1RM? I wish I had prizes. Does anyone know what that is? Just because we're kind of talking about exercise 101. I want to give you some basics about exercise, right? So one of my goals, yeah, go ahead. 1 rep max, that's right. I'd give you a prize if I had one. It's awesome. So 1 rep max. So it's 1 repetition maximum. So it's a way of measuring how strong you are. So it's essentially how much weight can you just push one time barely? So if it's a bicep curl, how much weight can I barely get up one time? It's just in the exercise world, it's a nice way of measuring. So I'll measure that for my patients at the beginning of my 3-month program, then we'll measure again at the end, and we'll compare how much progress. It's just a way of having a nice objective measurement of how strong you are. But then also gives us a place to start training, right? So if I'm going to go 50 to 60% of your 1 rep max, that just tells me how much weight I should be using for you for a particular activity. So I don't expect you to know how to do that or go out into the gym and trying to figure out your 1 rep max. If you're really super interested, I'd say let's go talk to someone who knows what they're doing and can do that for you. But in a practical sense, if you want to go in the gym tomorrow and start sorting this out, the easier way to do that is to find a weight that you can do 3 sets of 10 repetitions comfortably, correctly, and when you're in that last probably 3 to 4 reps of that last set, it's getting kind of hard, right? Because in general, to make a muscle stronger, you need to work it to the point of fatigue, right? If you have an amount of weight there that you can just do and have a beer in one hand and the weight in the other, and it's not stressing you at all, probably not doing yourself a bunch of good, okay? But at the same time, if you have so much weight that the last 5 reps you're using all of your body parts instead of the one muscle you're trying to work, you're going to hurt yourself, and you've already exceeded what you needed to do in the first place, which was to make that muscle tired, right? So that's a good way, just a practical way. And I don't do 1 rep max testing for all muscle groups, right? There's no reason to do it. It takes too much time. And the practical reality is I work in a clinical setting. I don't work in a research setting. If I worked in a research setting, I'd test all your muscles. But you know what? I see patients every 45 minutes, so I don't have time to test all of your muscles. I got other stuff we need to look at too. So it just gives us a way to measure progress. Okay? And most recommendations for resistance training, 2 days a week, 3 days a week. Relatively recent study indicating that going higher intensity than 70% of your 1 rep max, or doing more than 3 days a week, doesn't net you any more benefit than doing it a couple days a week. Okay? And so, like, you're like most people, you got other things to do with your time. So if lifting 4 days a week isn't any better than 2 days, maybe find something else to do with your time, right? Okay, intensity. What are we talking about? We're talking about exercise intensity. So how hard you're working. And this, I think, is probably the biggest variation, I would say, especially if you have an exercise background before you were diagnosed and started being treated for cancer. This is the thing that's probably the most different, right? Because typically, if you're an exerciser, you go until you can't go anymore, right? When you stop? Well, you stop when you can't go anymore. That doesn't really work for patients that are in the middle of active treatment. Moderate intensity is what I have found. There is some research out there where people are fiddling around with higher intensities. That's fine, but in general, I never start my patients at high intensity. People that are in treatment, or even people that have just completed treatment for my curative intent patients, I start everyone at moderate intensity. So, like heart rate, for example, that's probably the most accurate way of measuring exercise intensity. And the picture there is a beautiful little pretty picture. That's just an example of a heart rate monitor, so you can check where you are. Now, while that's very accurate, not everyone wants to go buy a heart rate monitor. It's not appropriate for everyone anyway. Some people that are on particular types of medications, beta blockers, if you're on a beta blocker for high blood pressure or arrhythmia, you can't use heart rate because those drugs blunt your heart rate response to exercise. So you're not going to be able to use that as a measure of intensity. Okay? And then again, we'll get to this later. And so the other two scales, the one that I use in my program is the perceived exertion scale, which I'll show you in the next slide so you can get a picture of that. It's a subjective scale as well as the dyspnea scale, so how short of breath are you? So in general, if you were exercising and you can't get more than 3 or 4 words out per breath, you're working too hard. Okay? And this is another speech that all of my patients hear me repeat myself over and over again. While you're exercising, the intensity should be moderate, you shouldn't be in pain, and you should feel good when you're finished. I always tell folks, when you walk out of my gym, your energy level should be as good or better than when you started. If you're exhausted, if you're dragging yourself out of the gym and you go home and sleep and it takes you 2 days to recover, you've done too much. Okay? What I found is if people can stay below that level, so they're not wiping themselves out like that, and they're stopping in time, they gradually will make progress. Okay? So here's an example of the RPE scale. Thanks to my wife for the beautiful artwork, because I can't do that. So this is a subjective scale where you are rating how hard the exertion feels to you. Okay? And moderate on this scale is between the 11 and 14, where the activity feels fairly light to somewhat hard. Okay? Again, it's subjective. Okay? For the number of nerds in the audience, the numbers along the left-hand side, if you multiply those by 10, they roughly correlate with heart rate. And usually what I find is when I'm working with patients and they're rating for me and I do the calculation for their heart rate range, where I set people, which is usually 50 to 60% of your maximum heart rate, that's where I usually start. It usually lines up right in that moderate range. Okay? So we have a couple of these posters around our gym, and so as people are exercising, I'm having them rate each activity. How hard is it? If they're rating it at an 8, we're going to make it harder. If you're rating it at a 17, we're going to make it easier. And my goal for them and for you is that you learn to listen to your body and make adjustments, right? Who feels the same every day? Not me, and I'm not being treated for cancer, certainly not people that are on treatment. So on your good days, you may be doing less. I mean, good days do more, bad days do less. But I want people learning to listen to their body and make appropriate adjustments while they're exercising. All right, so we've talked about some basics of, what makes up exercise, what qualifies, and so now, like on the resistance slide and the cardio slide, I mentioned those things as not starting points, those are goals. So how do you progress? How do you get from where you are to where, those goals are? don't start at the top, right? If you have balanced deficits, please don't start there. We're going to work your way up to it. So in order to know how to progress, how do you make things harder? When should you change what you're doing to try to achieve those goals? Well, three main variables in the exercise world are frequency, intensity, and duration, right? How often are you doing it? Frequency, intensity, how hard, and we talked a little bit about that already, and duration, how long are you going? So in general, when you are going to modify an activity, you change one variable at a time, okay? So for example, if I'm walking, I'm going to start doing my cardio. I have a certain circuit around my neighborhood. It takes me 45 minutes to do it, and I'm doing that 3 days a week. Okay, now, I've been doing that for a couple weeks, and now I'm rating it at a 7 on my intensity scale. Well, it's getting too easy, right? Change one variable at a time. Maybe you add a day, or you walk farther, or you walk longer, but don't change two variables at once, okay? When you change one variable at a time, it will get progressively harder in a nice, predictable, linear fashion. If you change multiple variables, it gets harder on an exponential kind of curve. And you're more likely to injure yourself, okay? When someone comes in with a musculoskeletal injury to see me in my clinic, one of the first questions I ask them is, what have you changed? Well, you know, I went from running on the street to running on the trails, and I went from a 3 miles to 6 miles. Okay, well, you just changed like 3 different things, and no wonder your knees are hurting you, right? Exercise does not have to be painful. That's my other thing, right? I mean, no pain, no gain. I just don't buy that, right? I don't think that's the way to exercise. I don't think it gets people where they want to go, okay? How are we doing so far? Okay, I want to leave room for questions if people have questions. Everyone tracking so far? Got some exercise basics, okay? So, next big question, and I get this a lot in the oncology world, is exercise safe for me? How do I know if it's safe? There was a pilot study done in 2011 where they were looking specifically at patients with inoperable lung cancer that were receiving chemotherapy for their treatment. And they determined that, yes, in fact, exercise is safe. Okay? So with certain modifications, and that's a big deal, and we'll talk about that at the end of this slide, it is safe in general. Now, what about for you specifically? I would say start with your oncologist. They may, if they have some specific concerns, usually around some other pre-existing condition, or, you know, depending on where you are, what type of procedures you've had done, they may not want you exercising, or they may want you to go see a pulmonologist first or cardiologist first. By all means, start there. Yeah?
I can save it till the end.
That's okay.
The studies that have determined that it's safe, I'm wondering if they've evaluated younger lung cancer patients. It's been my anecdotal observation that many of us were actually extremely fit before diagnosis, and that makes me a little nervous about, I'm concerned it might have actually contributed. I mean, I have no scientific basis, but clearly being extremely fit, we've got college athletes, professional athletes, fitness instructors, things like that going on, just above average exercisers, and going to anaerobic levels and things, and I just wonder if anybody's ever studied that, or if there's any specific things for the sort of atypical younger lung cancer patient.
So let me just rephrase. So you're asking, were the studies looking at less fit people, and is that generalizable to the young fit population, or vice versa, that they tested really fit people, and can I generalize that to the weaker people?
Warmer, did they test the more typical lung cancer patient that may not have been as fit, is probably a little older, and is that data applicable to the younger lung cancer patient?
Sure. Well, and it was mentioned in one of the other breakout sessions, it's what we call the N of 1, right? I can read a study that tells me broad things about groups of people, but not necessarily about the one person that's sitting in front of me. So yeah, so in general, those studies are going to be your more average patient, maybe a little bit more debilitated. So for me as a clinician, I worry much less about the people that have been super fit coming in, about the safety. Now, we usually have to have talks with them about how hard they're exercising because they're used to working really hard, and they're probably more comfortable at higher heart rate ranges and higher intensity levels. And so I need to have talks with those patients about dialing that back. So did that answer your question? Yeah.
Lisa and I've talked about this because I've always been a runner my whole life too, and I think when you've always had that mindset, it's hard not to push yourself to
Sure.
the limit sometimes. And my question and comment is kind of regarding the heart rate issues.
Mhm.
I have had part of my lung removed. I can no longer run. I do still try to push myself doing other things, but my heart rate gets extremely high, extremely fast.
Mhm.
Like if I'm pushing myself to what you would consider 14-ish, I'm at like 160.
Mhm.
And I just start walking on a treadmill, and like my warm up, I'm already at 100 pretty fast.
Mhm.
But I can breathe and talk. So
Sure.
I run it by my oncologist, and he's like, if you feel fine, keep doing what you're doing. But
Sure.
have you found maybe with some people in our situations that your heart rate is not really corresponding with kind of your
Absolutely, yeah. So the question was for people that are really fit or have other things going on, there's sometimes a mismatch between their heart rate and their perceived exertion. And have I seen that clinically? And the answer is yes. I see that a lot, both directions, where I'll have people, they're up there at 14 on the exertion scale and their heart rate's at 90. So I see it both directions. Depending on the person, I will recommend that they go with how they're feeling, okay? Because sort of like your question, if you're a distance athlete, you have become used to operating at a fairly high heart rate and you're comfortable with that. Your body feels okay at that place. Whereas someone who has not been an exerciser all their lives, to operate in that range, they're going to feel really uncomfortable, right? So a big part of when I meet with people is exercising with them, helping them sort that out, and finding that place where they're exercising hard enough to get benefit, but they're not exercising so hard that they're continuing to over-fatigue themselves, which gets into problems with your immune system, because if you're overtraining, even if you're a healthy person, that can have a negative impact on your immune system. And if we're suppressing it with medications, we also don't want you making that worse by overtraining. Okay? But inactivity is terrible, right? We all know that. They just redid the Dallas bed rest study a few years back, and they found that the amount of decline in peak VO2 after 30 days of bed rest was more significant than the amount you would see in 30 years of aging. So inactivity is bad. So we need to find something to do, right? And that's a big part of what I talk with people about, finding something to do. Yes?
So you just mentioned that people who exercise to excess, but really push themselves, could impact their immune system.
Mm-hmm.
So I think that might actually be more in line with what you're
Right. Is that kind of what you were getting at?
I'm more concerned that pushing to anaerobic levels, if that physiologically does anything to make your body more hospitable to the cancer growing.
I don't think there's any studies out there that would say that, but again, if you're consistently overtraining, I tell people, if you work hard a couple days, it's not a big deal, but if you're habitually doing that and you're doing that 6 days a week, week after week after week, I think you're asking for trouble. Again, it's just observation of what I've seen. Clinically, I don't think there's a study where they don't make people do that, because it's sort of hard to sign people up for that. But yeah, overtraining, even in a healthy population, right? People that are non-cancer patients, if you're overtraining, you can make yourself sick, right? Listen to your body. You should not be exhausted. Okay, that's the big thing. I think one of the big reasons why people don't come in and want to exercise, because they think it's going to make their fatigue worse. Yeah.
Good question. So often during cancer treatment, you feel okay, and you may be exercising, but then you get something,
Right.
pneumonia or whatever, who knows. At what point do you think it's safe to go back to exercising? And specifically, sometimes you're coughing, and when you're all gunky, is it okay to say, you know what, I might not feel that great, I can head back to the gym?
Right. It's an individual basis. If you were one of my patients, I'd be looking at your labs. I'd probably chat with your doc. If like say it's a pneumonia and you've been on antibiotics for several weeks and everything's pretty stable and the trends are looking good, your lab values are trending in the right direction, and I'd bring you back in. I'd dial you back a bit, for sure. My real immunosuppressed patients, like stem cell transplant people or some of the hematologic cancers where their immune system's pretty compromised, I'll usually check in with the doc and make sure they're okay with them being in the public gym area. Even though our gym's pretty small, we keep it really clean. Okay, exercise testing. I did want to mention this, I think, because sometimes people want to just jump out and start exercising. I do highly recommend that you stop in and see someone that knows what they're doing as far as they're familiar with exercise and specifically with the oncology population. Okay, because it helps establish a baseline so you know where you're starting, but more importantly for myself as a healthcare provider, I get to see how do you respond to, how is your body responding to exercise, okay? Because if you come in and you have normal to high blood pressure and we do one of the fitness tests I do, the 6-minute walk test, and when we come back, your systolic blood pressure has gone up 40 points and your diastolic's gone up 20 points, we're finished and you're gonna go talk to your doc. Doesn't mean you can't come back and exercise, but we want that blood pressure control to be better. Or how's your oxygen? How's your, are you needing supplemental oxygen when you exercise? I have lots of patients that come in and when I'm checking, they're low. And I said, do you check yourself at home? No, I just put it on when I feel short of breath. Not necessarily the best gauge of whether you need to be on oxygen when you're exerting yourself. So exercise testing is very valuable. It allows me to establish baselines for people, set goals, and make sure that they're safe to be exercising. And sometimes your trainer at the gym doesn't know what they don't know. It's not that they're bad people, they just probably don't have any experience with exercise with cancer patients. So getting started, how do you get started? Getting a baseline is a great place. Activity monitors, there's tons of them out there. Activity logs, some way of finding out, where are you starting? Are you exercising none, 1 day a week, 5 days a week? This allows you to know where you're starting, allows you to set measurable goals, right? Having goals is really important if you want to get somewhere. If it's some vague kind of, I think I want to do more, it's going to be really hard to measure whether you're getting there or not, okay? Set goals that are attainable, set goals that are important to you, right? I think that's a critical thing when you start talking about exercise in the oncology world. Whenever I'm meeting with a patient, I ask them, what are your goals? What do you want to get out of this? Because it doesn't matter what I want to do. If your passion is golf and you want to get back on the golf course, well, let's see if we can do that. Are there reasons you shouldn't golf? Maybe. If you have bony involvement, we may want to look at whether that's safe for you or not. But if you're setting a goal that you think someone else wants, it's hard to stay motivated if it's not something that you really want to be doing, okay? Also consider finding a group. There's an exercise program here at the Anschutz campus. If you're in Northern Colorado, I have my program in Fort Collins. There's a great program in Greeley on the campus of the University of Northern Colorado. I think especially getting established, that's a great way to start. Doesn't mean you have to stay there forever, but gives you some basis to get going. Goals, parameters for exercise, so that you can continue on, because like you've heard in a lot of the talks today, they start talking about treating cancer more as a chronic condition, right? So we need to do this long term. We have to have the long view of what we're doing, set yourself up to succeed, something that you can continue to maintain. Okay. Any other questions? Yeah.
I was just going to say,
Yoga's great. Yeah, with certain modifications. There are people that are out there that have specific training and they're aware of some of the limitations for cancer patients. Again, the big deal probably is if you have bony involvement, you may not be able to do everything, right? But it shouldn't hurt, right? No matter what you're doing. You may have to skip certain things, certain postures or, in general, don't push to end range, maximize flexibility things. But I love yoga for people. It's low impact, really focuses a lot on breathing, which especially for my pulmonary patients is a huge deal. So yeah, I think it's a great idea. Yeah.
That working with inconsistencies, my breathing is all over the place. I was saying moderate walker movement on some days I go up the hill far.
Sure.
Other days I have to stop 2 or 3 times going up the hill, and there's no way to build further when it's so inconsistent
Sure.
all the time.
Right. Her question was dealing with inconsistencies where you have good days and bad days. Some days your breathing's good, some days are not so good. Some you just kind of have to go with that and do what your body will allow you to do. Some of those pulmonary function things you're not going to really be able to necessarily impact if it's a volume problem, but that's where resistance training can come in, and you can actually improve your overall function by improving the efficiency of your skeletal muscular system, right? With resistance training can actually help your overall function. Okay, so you want me to wrap stuff up for the next session, and I'll be around afterwards if you have more questions.